This is Dr. James with Helpmommy.com, and if you enjoy these videos, please like and follow our page so that we can keep this going. I was asked about the topic of torticollis. Torticollis is a condition where your head starts to tilt to one side and you're unable to bend or move your head from side to side like you're supposed to. There's a couple different reasons why this could happen. One is congenital, where it's just stuck that way. That's something that doesn't happen very often. The second one is acquired. This is by far the most common, and it usually happens from a birth trauma, where as the OB is delivering the baby and trying to get the shoulder through the birth canal after the head comes out, the muscle that's here on the neck, called the sternocleidomastoid muscle, has a little tear or is pulled. Then as that muscle goes to heal, it forms a knot and starts to shorten it. And that happens around the time the baby's like 3 to 6 weeks old. So the baby will come out looking fine. And then as they start to get a little older, people start to notice that their head starts to tilt and they're not moving their head from side to side. This will also cause the back of their head, one side, to become extremely flat. This is typically treated by going to physical therapy and them stretching it out and teaching you exercises to do at home. The earlier we find this and get it diagnosed, and the faster we initiate treatment, the easier it is to fix. The longer it goes on and that head stays tilted, you start to see some shift of facial features that, if it goes on long enough, can be permanent and make their face not as symmetric as what it should be. And of course, then the longer it goes on, the harder it is for us to reshape the head as well. There is another type of torticollis, which is usually spastic torticollis, and this can happen from a cramp, a lot of times from a crick in the neck or sleeping wrong. This is usually temporary. This can happen at any age, and this is something that a lot of times you can treat with ibuprofen, heat, massage, or even a muscle relaxant. But that's what torticollis is and how we treat it. I hope this helps.